All right. Good afternoon, everybody. This is Joshua Smith. Thanks again so much for joining us here this afternoon for our Independent Blue Cross Medicare meeting. We're joined today by Christopher Marshall. He's the Medicare broker executive at IBX. He's going to be giving us a great rundown through some of the 2021 benefits and about working with these products to be as successful as possible during the AEP. All of the microphones are going to be muted, but please feel free to join us and type in the chat any questions that you have, and we'll be able to address them as the sales team, but Chris will also be able to address them during the presentation as well. Without further ado, take it away, Chris.
Good afternoon, everybody. Thanks for attending. I really appreciate it. Today, I'm going to go over our 2021 Independence products. This is a really in-depth presentation, so I hope I have about an hour of your time. If not, you'll be able to access this presentation again. The recording will be available to you. So let's get started. All right. Today, during our presentation, it'll be some key takeaways that all of you guys will have from the presentation. I would describe what's new and changed for 2021 with our Medicare Advantage products. You'll be able to discuss formularies, provider networks, and designated sites and how those changes have taken place in the 2021 plan year. You'll be able to identify key features of the HMO products and our personal choice PPO 65 products. You'll also be able to identify additional benefits and services that help our members manage their health and wellness, okay? And I'll just leave you with some key identifying points that I want you to remember when out there selling. And I'll also go over at the end our 2021 Medigap Freedom Plan. If anyone has Medigap beneficiaries or clients that are in that space, you'll be able to market those products as well. All right, what's new and what's changed in 2021? We have highly competitive offerings and positive benefit changes on every one of our plans in the 2021 plan year. We have our our 0 monthly premium plans, which a lot of people are already familiar with. Now we have 3 plans that are we have 3 plans that are 0 premium. We have our Keystone Basic HMO, we have our Keystone HMO-POS, which is in Philly and Bucks only, and we have our Personal Choice 65 Prime. All 3 of those products have a 0 premium to market to our clients. All right. 0 copays. That's one of our major takeaways this year. Copays have been eliminated for 2021. All PCP copays are 0 on all plans across the board. HMO and HMO-POS plans, they're 0, okay? If 2021 as well, tiering has been removed. So any medical tiering that you saw on previous years with doctors, that has now been eliminated. The PCP is the PCP, and you would just pay your flat $0 copay, all right? And we've also added a $0 telemedicine benefit through MD Live on all HMO and PPO plans. And there's also been an added benefit of the behavioral health telemedicine portion as well. And we've also added that with a copay of $5 on certain plans. So that's also an added additional benefit that'll be great for our beneficiaries, especially in the time of this COVID and uncertainty. And our seniors and our older population, they don't want to go out and travel as much. And if they want to go utilize this opportunity to go see a provider because they may be down on being depressed or not being able to get out and talk to people, that's been added as well. And that's going to be a great benefit you'll be able to offer to seniors as well. All right. Lower copays in 2021. Like I said, PCP has been lowered, specialist has been lowered, telemedicine has been lowered, our inpatient hospital has been lowered, outpatient surgery and observation stays, and I'll explain what the difference is later on in the presentation. Complex radiology, any MRIs, CAT scans, PET scans, anything higher than just a standard X-ray, we simplified it and lowered the copays on those as well, all right? And tier 1 medical prescription drugs. On the MAPD plans only, we've reduced the cost of your tier 1. Typically, those are your generic maintenance medications that are your day-to-day drugs that you use, okay? All right. Another great benefit that we've added in 2021 is our embedded dental, vision, and hearing. Now, this has been one that's been offered in years past, but as a choice program, sort of like an additional rider that you pay for when you purchase the plan at the beginning of the year. Now, this plan it's embedded. So seniors do not have to worry about paying that additional $7 for the choice program to get that coverage for dental, vision, and hearing, as it's embedded in these plans now, okay? All individual MA plans in 2021 include a routine exam and cleaning every 6 months with an enhanced benefit, all with a zero copay, all right? On the comprehensive dental, you get in between a $1,500 or a $2,000 annual maximum with lower cost sharing for comprehensive dental services in 2021. So depending on which plan option the senior enrolls in will determine the allowance that they get for the comprehensive dental, okay? Vision, your routine vision benefits. Obviously, we've utilized Davis Vision for a long time. That is our vendor. It's included in all MA plans. You pay a $10 copay for an eye exam every year. Lenses and frames are an allowance that's covered annually. Sometimes in years past, you would see that these allowances are only covered every 2 years. Every few years, now seniors have the satisfaction and the comfort of knowing I can get frames or lenses every year, and I'm not trying to hold on and protect this one pair of glasses. If something happens, I'll be able to replace them. So that's always a good benefit for our seniors because things happen. Routine hearing benefits through True Hearing, okay? All included in all MA plans as well. And we are also offering a new rechargeable hearing option that's available in 2021 on our premium hearing aids, okay? So depending on the type of plan that the senior enrolls in, whether it's HMO, HMO-POS, or PPO, the copay will differ for that hearing aid, okay? More exciting changes in 2021. Our personal choice 65 prime is better than ever. Medical tiering has been removed from in-network benefits, and the $1,000 out-of-network deductible has also been removed. We have enhanced our over-the-counter benefit. We're using a company now called Incom, and that access to the OTC items at retail stores and online, as well as they can still utilize the catalog that they've been using in years past as well. And the difference with this year's OTC benefit, the reason why it's so good and enhanced is because it's like a debit card now. So if a senior wants to walk right into their local Walgreens, Rite Aid, any of the participating pharmacies, they can actually pick up those over-the-counter items that they need, swipe their card, and continue on about their day, as opposed to sometimes shopping in that catalog and they thinking those materials are overpriced in the catalog and they're not really getting the bang for their buck. This eliminates that, and if they still do want to utilize the catalog, obviously they still have that. Okay, so that's a great benefit with that debit card access that they'll have at their availability. Telemedicine, $0 copay for medical visits, and behavioral visits have been added with a $5 copay, as I touched on previously, okay? And that's going to be key in these times of uncertainty, COVID and your medical condition, your mental health. Everyone probably wants to talk to someone at this point, so adding that on was a great benefit for us. All right, acupuncture. That's something that typically was not covered or was covered very limited in the past. We're covering acupuncture this year, 6 routine visits for Medicare covered acupuncture services. Now, what that means is the member must have the following conditions: headache, migraines or tension, post-op nausea and vomiting, chemo-induced nausea and vomiting, lower back pain, chronic neck pain, pain from osteoarthritis of the knee and of the hip. Now, all of these conditions must be medically diagnosed, not just word of mouth diagnosed from the member if everyone follows. The doctor has to physically diagnose these, and it has to be in your claim history in order for this to be considered a routine acupuncture visit, okay? COVID-19, we're all in this together, as I touched on in the past. Right now, with all the uncertainty in the world, as I was touching on, we want to make sure that our seniors are very comfortable and know that if something does happen, they are well taken care of with their medical insurance and their health needs. Okay, so in 2021, what we have done is obviously we've eliminated the copay for your primary care visits, as well as family doctor visits through MD Live. Okay, and any in-network inpatient hospital stays that are the result of a diagnosis of COVID, the member will not pay that cost sharing. Okay, so inpatient will be a zero cost sharing if the diagnosis is from COVID. Okay, so they don't have to worry about if they're having the symptoms, if they're sick, if they do get diagnosed with COVID and have to stay in the hospital 10 days, they don't have to worry about that overhead bill hitting them and kind of breaking the bank a little bit. Okay, all right. Moving along, we're going to talk about formularies, provider networks, and designated sites, or as some of us may know them as CAP sites. Okay. All individual medical advantage with prescription drug, HMO, and PPO plans will utilize a 5-tier closed formulary approved by CMS. Okay. This formulary is updated throughout the year, so we want to make sure we're always checking the members' medications to verify that that tiering has not changed or it is still covered under the formulary from year to year. Okay. And obviously, our formulary can be found at ibxmedicare.com, and all MAPD plans have a preferred/standard pharmacy network. Okay. Prior authorization and prescription orders. Okay. Referrals are not required with our HMO plans. However, some services may require prior authorization from the Keystone 65 HMO plan. Network providers complete this process for our members, such as MRIs, CAT scans, PET scans, anything that's any type of high-tech radiology, any of those advanced imaging services. You still want to have your provider submit that prior authorization. Okay, still need that, as well as a script to go get lab services done. So if your doctor wants you to go get blood work from LabCorp, you still need to get that script from your doctor and get the to get your blood work. Okay, but to go see a specialist, they will not have to get the referral. Just to clarify, they will not have to go get the referral to see a specialist, but they will need a script in order to go get blood work and things like that. They don't have to wait to see their PCP if they need to see their cardiologist first. Okay, so they can go directly to their cardiologist without having to wait for their PCP to write that referral. Okay, provider network. Individual Keystone 65 HMO and HMO point-of-service members are required to select a PCP each year. Therefore, it's very important to confirm doctors, especially PCPs, and hospital needs before a beneficiary selects a plan. Although referrals are not required with our individual Keystone 65 HMO and HMO point-of-service plans, the PCP is still responsible to coordinate the member's care. So we always want to remember to look up the member's primary care doctor to make sure that they still accept our plan. We have the largest network in the area, so most of the time members are not having issues with their doctors, but we always want to make sure that that primary care doctor is in network, as well as the facility that the primary care sees this member at. All right, our HMO and our HMO-POS networks. As I was speaking about, we have one of the largest network in the area. We have over 87,000 physicians and 100 hospitals within the PA5 and in New Jersey, okay? And that's under our Keystone 65 Basic Plan, our Keystone 65 Select Plan, and our Keystone 65 Preferred. All of those products fall under the HMO umbrella, okay? Now, we also have a slightly smaller network, which is more defined, and it's under our Keystone 65 focus. Okay, it's our Keystone 65 defined provider network that has 59,000 physicians in 20 hospitals across the PA5. Okay, and that's obviously our Keystone 65 focus RX with HMO with the point of service option. Okay. Designated sites, or CAP sites, as some of us may know them as, for our individual Medicare and HMO POS plans, apply only to lab services. Okay, so the member must use the designated site from their PCP. So if their PCP is capitated to Abington Memorial Hospital for blood work, they need to go to Abington Memorial Hospital for blood work. They can't just walk into LabCorp because that's not where their primary care provider is designated to go. Okay, so they must use their designated sites. And that's gonna, I know a lot of times that's tough because a member will say, hey, I live right down the street from LabCorp and my designated site is the hospital 5 miles away. Unfortunately, they will have to use their designated site that their PCP is capitated to, okay? And it's no, can't get around that unless obviously extenuating circumstances apply or something like that, but they have to utilize their CAP site. Removal of medical tier services. On our Keystone 65 HMO and point of service plans, as well as our personal choice Prime RX PPO plan, we've removed medical tiering, okay? In 2021, the PCP preferred standard tiering has been removed. The PCP copay on all individual HMO and HMO point of service plans is a $0 copay. On our personal choice Prime PPO in 2021, preferred standard tiering of 6 in-network services has been removed as well. As in 2020, our pharmacy network with the MAPD plans will continue to utilize our preferred standard network as well. All right, Medicare Advantage products and benefits. So this is where we'll start going into the different individual products that we'll be offering and that you'll be able to offer to our beneficiaries out here when you're selling the plans. All right, first, we'll start with our Keystone 65 basic HMO plan. All right, as you can see, the premium in all 5 counties is $0 across the board, as well as the PCP copay is $0. Your specialist, you'll see, will be a $40 copay. Emergency room is a $90 copay. Now, you're not waived if you're admitted. So if you're admitted to the emergency room, you still have to pay that $90 copay. Please make sure you stress that to the seniors because some plans, some years past, it's been waived if you're admitted. You still have to pay your $90 copay, no matter if you're admitted or not. Okay, urgent care benefits. If you go to a retail clinic, you will pay a $15 copay. If you go to the actual urgent care center, you will pay a $40 copay. Any outpatient hospital surgeries, anything done in an outpatient hospital on an outpatient basis, if you get it done at the hospital, you'll pay a $350 copay. If you get it done at the ambulatory surgical center, you will pay a $200 copay. The difference between the two is ambulatory surgical, you will not be able to admit anyone into an ambulatory surgical center. A hospital has admitting privileges. That's the major difference between the two facilities, okay? An inpatient hospital. Under this plan, you'll pay a $250 copay, a flat fee per day, up to 7 days, which leaves the member with a $1,750 maximum stay for an inpatient hospital stay if they were in the hospital, God forbid, 10 days, okay? That $1,750 goes towards their MOOP, which is $7,550 for the year, okay? All right, highlighting the major changes on the plan this year. As you can see in 2020, the PCP copay went down $15 because of that removal of the medical tiering. So it's just a flat $0 now. $5 specialist copay, a decrease of $5, excuse me, for a specialist office visit. Telemedicine, it's a $0 for medical visits and $5 for behavioral health. Last year, behavioral health was not even covered, and last year it was $5. So it's pretty much balancing itself out. You we're adding one benefit and the member does not have to now pay for the medical portion of it. So it kind of balances itself out if you look at it like that. Okay. Routine dental, vision, and hearing was a buy-up in the choice program, which was an additional rider you had to pay for. Now it's embedded in the plan, depending on which plan you select. All right. And our over-the-counter allowance, it's a $60 over-the-counter allowance on this plan. In 2020, it was a $30 over-the-counter allowance. And this year, you have that access to utilize that debit card. So not only have we increased the allowance, we've also made it easier for the members to shop and get those over-the-counter products that they're looking to utilize on a day-to-day basis. All right. Tier 1 copays have gone down from $2 to $1 in this year. Acupuncture was Medicare covered acupuncture services last year. This year we're covering 6 routine visits per year. All right. Skilled nursing increased by $19 for days 21 through 100, and our maximum out of pocket increased by $850. And to explain that to the member, if they can add, they'll ask you why those two specific benefits increased. What you explain to them is because of the increase, because of all the additional benefits that were added this year, we had to increase something, and those were the two benefits that had to be increased: the skilled nursing and the maximum out of pocket, in order for us to be able to offer those extra additional benefits that we're offering in 2021. All right. Routine dental with our Keystone 65 Basic RX HMO. Under this plan, you'll pay a zero copay for one oral exam and cleaning every 6 months. There's a zero copay on your x-ray. That's the bite wing x-ray. Now, there's a periapical x-ray every 3 years and a full mouth panoramic x-ray every 3 years. Those would be a zero copay every as well, but just remember the allowance is every 3 years and not every one like your standard bite wing x-ray. Okay. They also, under this plan, will get the $2,000 comprehensive allowance each year. All right. They would pay 20% co-insurance for any restorative services. So if they had any fillings, simple extractions, any endodontic work, which are root canals and crowns, any extractions, any periodontical work, such as scalings or root planing, the member is responsible for a 20% co-insurance, right? Any prosthodontic services, such as dentures, bridges, or partials, the member will be responsible for 40%, as well as any maxillofacial surgeries that they would have to undergo, all right? Our vision benefits. Standard, member pays a $10 copay for a routine eye exam each year. Now they have two choices. They have a $200 allowance every year for frames and lenses purchased through VisionWorks, or they have a $150 allowance for frames and lenses purchased at a Davis Vision network provider. So they have the choice of how they want to utilize their benefit and where they want to get their glasses, lenses, or frames, but the allowance is different depending on what they use, okay? Who they use. They also $150 every year for contact lenses and frames in lieu of lenses and frames. So they can't get both. So you can't go get some lenses and frames and say, I want to get some contacts for the weekend as well. You have to, it's basically the allowance goes to one or the other, all right? And just remember, whenever you're advertising this to the member or letting them know about this specific benefit, always remember to let them know tint, progressive, transition lenses, and polish. Those are separate benefits that insurance does not cover and would be coming out of their pocket if they did want to add those on to their glasses, okay? Our hearing benefit. They pay a $10 copay for a routine hearing exam every year. As far as the hearing aids under the basic plan, they pay a $699 copay for a standard digital hearing aid, or a $999 copay for the premium digital hearing aid. I like to call those the Cadillac hearing aids. of the two. So those would be, the member wanted to utilize that benefit, they would pay $9.99 for the premium one. Okay. Now, each year they pay a zero copay. They would pay a zero copay for 3 fittings and evaluations each year. So we're not just going to give you a benefit for a hearing aid, give you a hearing aid, and say, figure it out. We're going to help you get through utilizing and using your hearing aid. That's why you'll have your 3 fittings and your 3 evaluations each year at that zero copay. So if the member wanted to go once each quarter, they could do so, and it would be a zero copay, and they wouldn't have to worry about coming out of their pocket any extra expense because they needed a hearing aid. Okay, and it's covered under a 1-year warranty and a 45-day trial period on the hearing aid. Okay, and they also get a starter pack of batteries. The hearing aid does not count towards that maximum out of pocket. So if a member utilizes the premium hearing aid and pays that $9.99, should just round off to $1,000, and that $9.99 would not go towards that maximum out of pocket for the plan year. That's something separate. Okay. All right, moving on to our Keystone 65 Focus HMO Point-of-Service plan. As you can see, this plan is offered in all 5 counties as well, but the premium differs. In Philly and Bucks, it's a zero premium plan. In Chester, Delaware, and Montgomery, $15 premium each month. Primary care visits, again, are zero across the board. Specialists are $40. Your emergency room, again, will be a $90 copay. Slightly different. Urgent care on this plan is $10 if you use a retail clinic and $40 if you use the actual urgent care center. Anything done in an outpatient hospital, outpatient setting, $325 at the hospital, $200 at the ambulatory surgical center. Inpatient on this plan has been reduced from 7 days to 6. It's a $210 copay for a maximum of 6 days, which leaves the member with a $1,260 responsibility, which would then apply towards their maximum out of pocket of $6,500 for the plan year. Okay. And now remember, because this is a point of service plan, the member does have an out-of-network benefit, and they would pay a 20% co-insurance with a $1,000 out-of-network annual plan benefit maximum. Okay. How the Keystone 65 Focus Rx point of service plan works. You have out-of-network benefits, as I previously stated, with a $1,000 annual plan benefit maximum. Okay. Medicare Part A and B cover services only, and you only pay the allowed amount of a covered service, not the doctor's charge. We always want to stress that to the members because that's very important. A doctor can submit a claim for $10,000, but if the allowed amount for that service was only $1,000, the member will only be responsible for that $1,000, not that $9,000 difference. Okay, the doctor will not balance bill and should not balance bill for these services. Okay, that's why it's important to stress to the members you will only have to pay the allowed amount, not the doctor's charge. Again, members will see these doctor bills, see a large bill, but it'll just be what they submitted to the insurance company, not what we allowed for that service. Okay, so just always remember to stress that to the member: what's allowed, not what's charged. Okay. Point of service services do not go towards the MOOP, because if you're going out of network, we're not going to give you credit for going out of network and apply that towards your in-network maximum out of pocket. So if you go out of network, it's not going to count towards that MOOP. Okay. All right, the Keystone 65 RX HMO POS, how that plan works. Continued, it uses a defined network of participating providers that include over 20 hospitals across the PA 5 county region. The defined network has approximately 59,000 physicians and specialists. And again, you must elect a primary care physician from the Keystone 65 Focus HMO POS network. The PCP will provide and coordinate their care to other Keystone 65 HMO POS network specialists, hospital, and healthcare providers for services they need within the network. But again, remember, you do not need a referral to see specialists, but you do want to coordinate your care with your primary care, all right? Mental health substance abuse network is contracted by Magellan and will contain the same network providers for all Keystone 65 HMO network. So Magellan's network is Magellan's network. So it doesn't matter if you have the Keystone 65 Select, Focus, Magellan's network is Magellan's network, all right? Emergency services and urgently needed services are covered at an in-network cost sharing at non-contracted locations. Member was visiting their mother and their relatives in Ohio for Christmas. She gets sick. She goes to the ER in Ohio. She would pay at the in-network rate because she has no control over that medical emergency taking place, and we're not going to penalize you for a medical emergency in another location. Okay. As you can see, here's our Keystone 65 HMO Rx POS hospital network map. And I'll just go through them quickly with you. In Bucks County, you have Abington Health Center, Warminster, Jefferson Health. Bucks, you also have Aria Health, the Bucks County Division, Doylestown Hospital, Grandview, and St. Luke's Quakertown. In Chester, you have Brandywine, Jennersville, Paoli Memorial. In Phoenixville, Delaware, we have Riddle Memorial. Montgomery, we have Abington, Bryn Mawr, Holy Redeemer, Lansdale, Lankenau, and Pottstown. And in Philadelphia, we have Aria Health, Frankfurt, and Tarsdale divisions, Chestnut Hill, Methodist, and Thomas Jefferson Hospital. Those are the EOS Focus Network hospitals. All right. Changes under the Focus POS plan in 2021. As you can see, the Philly and Bucks premium has gone down to $0 from $9, and the premium in Chester, Delaware, Montgomery has gone down to $15 from $19. So it's a reduction in the premium. Primary care physician, obviously, is a $0 copay. Behavioral health, telemedicine is a $5 copay. And there's no telemedicine medical copay, excuse me. Dental, vision, and hearing is embedded in the plan for 2021. And over-the-counter allowance through Incom, you're also getting a $60 allowance, which is up from $30 last year on this plan as well. All right. Outpatient hospital, we've decreased that by $25. Tier 1, the copay on RX drugs has gone down $1. Acupuncture, we've given you 6 routine visits per year. For the year, the MOOP has decreased by $200 on this plan to $6,500, and your skilled nursing increased on this plan by $20 for days 21 through 100 from $164 to $184. Again, dental on this plan, $0 copay for 1 exam and 1 cleaning every 6 months. They pay their $0 copay for an X-ray. The bite wing is once every year. The periapical and panoramic are once every 3 years. Okay. They also, under this plan, get a $2,000 allowance every year, and they would pay 20% coinsurance for restorative services, endodontic extractions, and periodontic, and 40% for any prosthodontic services or oral maxillofacial surgeries. Vision, same thing. They pay a $10 copay on their plan for 1 routine eye exam per year. They have a $200 allowance for frames and lenses purchased through VisionWorks, or they get that $150 allowance if they use a Network Davis vision provider. They don't want the lenses or frames and they want to get contacts, they could do so as well, and they all would have a $150 allowance for those contact lenses, excuse me. All right, hearing. For routine hearing services, exams, and aids. Again, they pay a $10 copay for their 1 routine hearing exam a year. Under this plan, they would $699 copay for their standard hearing aid, and they would pay their $999 for the premium digital hearing aid. And it includes the rechargeable option, obviously. And they pay it's a $0 copay for 3 fittings and evals per year. So again, We're not going to leave the seniors by the wayside. Once we give them a benefit, we'll make sure that we walk them and nurture them through these 3 visits and evals per year. They get their covered under a 1 year warranty, 45-day trial period to test it out to make sure that it actually fits, they like it. Within that 45 days, they can always return it. If they want to try another one, if the standard one didn't work and they wanted to see if the premium did better, they could always do so. That's what the 45-day trial period is for. And they'll always get that starter pack of batteries. All right, our Keystone 65 Select Plan. That plan has been around for a while, as everyone is whoever has sold this product is familiar with. This is pretty much one of the older plans on the MA platform. We have the MA only plan in Philly and Bucks, which is $34.50. We have the MAPD plan in Philly and Bucks, which is $56.50. We also have our MA only option in Chester, Delaware, and Montgomery, which is $49.50. And we also have our MAPD option in Chester, Delaware, Montgomery, which is $82.50. All right. Now, just to let you know that the Keystone 65 Select Plan this has the larger network. They're in the network with the 87,000 doctors, not in the defined network. So other than that, that's the only difference between the Select and the Focus would be the network, the definition of the network. You're just getting a little bit more doctors in the Select than you would be in the Focus. But as far as cost or anything like that, it's no difference. Okay. Your primary care visits are $0 for the year. Your specialist would be $40. Your emergency room visits obviously are $90 across the board on all plans. Urgent care is $15 copay at the retail clinic, if you walk into a clinic. And if you go to the actual center, you would pay $40. Anything done on an outpatient basis is a $350 copay at a hospital and a $200 copay at the ambulatory surgical center. Under this plan, our per day copays would be $250 per day, up to a maximum of 6 days. And that $1,500 maximum will go towards the annual MOOP on this plan of $4,900. Major changes on this plan. Obviously, the PCP has gone down from $15 to $0. Telemedicine, $0 for any medical telemedicine visits, $5 for any behavioral health visits, okay? In 2020, there was no comprehensive dental, vision, and hearing offered on this plan, but now in 2021, it's embedded. So that's a major change in the Select plan because you couldn't even purchase the buy-up option on the Select last year. Now we've embedded it in the plan. The maximum out-of-pocket on the plan for this year is $4,900, down from $5,500 on last year's plan. And acupuncture was only a Medicare covered service. Now we're giving you 6 routine visits per year. All right. In 2021, our SNF benefit was $165, which is skilled nursing. This year it's up to $184. Okay. And the premium across the board in all 5 counties went up $2. Philly and Bucks, went up to $56.50. And in Chester, Delaware, and Montco, it went up to $82.50. So it was just a $2 increase across the board. On the Select, they also get their routine dental, vision, and hearing benefits. They pay their $0 copay for an oral exam every 6 months and cleaning. Again, bite wing x-ray is a $0 copay. Periapical and full mouth, it's every 3 years. So just always stress the allowance is every 3 for those 2, and the regular bite wing they get every year. They'll get their $2,000 allowance on this plan, and any restorative services under this plan would pay 20% co-insurance, any endodontic extractions and periodontics as well, okay? 40% co-insurance will go to any prosthodontic work or oral or maxillofacial surgeries. your routine eye exam. You pay a $10 copay for one eye exam per year. Now, again, under this plan, the allowances are different just depending on where you go. If they want to utilize a VisionWorks provider, they get $200. If they want to utilize an in-network Davis Vision provider, they'll get the $150 for frames and lenses. If they don't want to utilize the frames and lenses option, they can get contact lenses and they will get that same $150 allowance, okay? $10 copay for your one routine hearing exam every year. And under this plan, as you can see under the select option, the copay for your hearing aids has been reduced. It's only $499 on this plan, as opposed to $699 on the other plans. And the Cadillac one, the premium hearing aid, will be $799 on this select option. Okay, so it's down about $200 on from the select plan to the Focus and the other HMO options. Okay, and again, under this plan, zero copay for their 3 fittings and evals per year. They'll get their 1-year warranty and the 45-day trial period to make sure that they like the product and it's working well for them, as well as always giving them their batteries to make sure they can turn the hearing aid on. All right. Our preferred Keystone 65 preferred HMO plan. That plan has obviously the MA only option as well as the MAPD option. And Philly and Bucks, the MA option only is $178, and the MAPD option is $230. All right, in Chester, Delaware, Montgomery County, it's $194 for that MA only option. And Chester, Delaware, and Montgomery County, for the MAPD plan, it's $258. All right, and again, our primary care doctors are a zero copay across the board. They would pay $40 to see their specialist under this plan, $90 for their emergency room. Again, it's not waived if they're admitted. They would pay a $5 copay to go to the urgent care, the retail urgent care, and still the standard $40 copay if they walked into their urgent care center. Okay. Anything done on an outpatient basis under this plan will be a $350 copay at the hospital. And if they go to an ambulatory surgical center, it's a $125 copay. So it's really beneficial under the HMO preferred plan. If you have any seniors or beneficiaries that are enrolling or looking to enroll in that plan, that if they have anything done on an outpatient basis, it's really more than split in half if they go to a surgical center and have their services rendered, okay? Under this plan, it's a $225 copay for the first 6 days, which leads the member to have a maximum of $1,350 per stay if they were in for the maximum allowed time of 6 days. And then that $1,350 would go towards their MOOP of $4,000 for the plan year. Again, highlighting the major changes on the preferred plan, there's a $0 PCP copay, which is down last year from $5. Telemedicine, we've added the behavioral health portion, which is a $5 copay, and it was not even covered last year. And your medical visits are down from $0 from $5. Okay. Acupuncture was a Medicare covered service. Now, again, under this plan, you're getting your 6 acupuncture services per year. Skilled nursing under this plan is up from last year. It's up $20 for the days 21 through 70. It's $170 up from $150. And again, the premium increased across the board in all counties on $2. So in Philly and Bucks, it went up from $228 to $230, and in Chester, Delaware, and Montco, $256 to $258. All right, under the HMO preferred, remember, you only get preventative dental only. So the comprehensive benefit is not added on to this portion of the benefit. They do not get the comprehensive portion, the $2,000 allowance. They only get routine services under the preferred plan. So I just want to stress that and make sure everyone's aware You do not, under the preferred plan, get any comprehensive dental, only routine, all right? You'll still just pay your flat zero copay for your exam and cleaning every 6 months, and your bite wing x-ray, zero copay. And again, your periapical and your full mouth is once every 3 years, okay? Okay, vision under the preferred plan. You pay a $10 copay for your routine eye exam every year. And again, the allowances are it's the same. You get your $200 allowance for frames and lenses if you go through VisionWorks. You get your $150 allowance if you go through an in-network vision provider. Okay, if you do not want the frames and lenses, you wanted to get contacts, you also have that $150 allowance. It's either or though. You can't double dip and use both. All right. And your hearing under this plan, you pay a $10 copay for your routine hearing exam every year. As far as the hearing aids are concerned, under this plan, $499 copay for the standard digital hearing aid, and you would pay a $799 copay for a premium digital hearing aid. Okay. And again, if I haven't stressed or stated in the previous slides with the hearing aids, they all include a rechargeable option, and you get one aid per ear per year, okay? 3 fittings and evals per year at a zero cost sharing, and you get a 1-year warranty and a 45-day trial on the hearing aid, okay? As well as the starter pack of batteries. Okay, now we've touched on all of our HMO plans. Now I'm going to move and we'll go over our PPO plans, the Prime, and we'll have our personal choice, our Prime, and our standard personal choice PPO 65. On our personal choice Prime PPO, it's a zero premium in all 5 counties. And this is a really, really popular plan. As you know, people like to have the flexibility of having a PPO and being able to go to say the term where they want. And having a zero premium PPO really gives seniors that satisfaction that, wow, I'm getting the bang for my buck with my plan. I have a blue plan and I'm paying a zero premium, and I still have the access to a lot of the doctors, hospitals, facilities, as well as these other services that they're giving to me as well. So this is a really, really strong plan. $5 copay visits for your PCP. Specialist would be 40. Emergency room would be 90. It's across the board. Urgent care, if you walk into a clinic, it's a $10 copay. If you go to an urgent care center, it's a $40 copay. Anything done on an outpatient basis at the hospital would be a $375 copay. If it's done in an ambulatory surgical center, it's a $245 copay. All right, $250 per day for a maximum of 7 days on an inpatient stay. And that inpatient MOOP would be $7,550, okay? And you're out of network. If you were to go out of network, your coinsurance would be 40%. In 2021, we've removed the standard preferred tiering, and it's just a flat $5 copay for your PCP on this plan. Again, we've added the behavioral health telemedicine benefit for $5, and we've taken away the medical benefit for telemedicine, and it's only $0 this year. Acupuncture's Medicare covered service. Now we're covering it for 6 routine per year. Under this plan, you'll also get a $60 allowance for your over-the-counter items, and your comprehensive dental, vision, and hearing is included in the plan, which is embedded within the benefits, excuse me. Urgent care is a $10 decrease from last year as well. We removed the standard preferred tiering for outpatient or observation stays from $475 to just a flat $375 now. Ambulatory surgical services are $245 this year, down from $250. And again, the RX tier 1 copay tiering is $1 as opposed to $2. And this year, if you go out of network on the PPO plan, you just pay a flat 40% coinsurance. There's no deductible plus that coinsurance this year. Last year, you would have had to pay $1,000 first, then 30%. Now you just pay a flat 40% coinsurance, which is really good if members want to go out of the network and not utilize a Blue provider. Any complex radiology, MRIs, CAT scans, CT scans, PET scans, anything like that, it's a $275 copay. That was an increase from last year from $225, okay? The maximum out-of-pocket on this plan is $7,550 for in-network services, and that's an $850 increase, which for the combined from last year for the in and out of network services combined, okay? So that did go up a little bit. And our skilled nursing went up from 165 to 184 from last year to this year for days 21 through 100. And again, the easiest way to explain the increase in benefits to our prospective beneficiaries or even our members that are already clients that just want to know why those benefits increase. In order to add additional benefits onto our products each year, we have to make concessions, and these were the concessions that had to be made for certain benefits. That's the easiest way to explain it to a beneficiary. In order to give, it's a give and a take, pretty much. Okay. Personal Choice 65 Prime RX PPO. Here are their comprehensive and preventive dental benefits. As you can see, they're pretty much the same as on our HMO platform, a little bit different as far as comprehensive benefits, as you'll see when we get to the bottom. Obviously, again, you'll pay a $0 copay for your x-rays. Bite wing is once every year. Periapical and full mouth panoramic once every 3. Now, the allowance has changed on the PPO Prime, whereas though on the HMO you saw a $2,000 allowance, this allowance is only $1,500, and it's a combined for in and out of network because obviously it is a PPO plan, okay? There's a 20% coinsurance, which includes restorative services, which are fillings and extractions, and the endodontics, extractions, and periodontic services. Those are all things that are just your 20% coinsurance. Anything more invasive on the dental side, such as prosthodontics or any other oral maxillofacial surgeries, you would then pay 40% coinsurance, okay? Vision, you'll pay your $10 copay for your eye exam each year. And again, the allowances don't change. You'll get that $200 allowance through VisionWorks or $150 through an in-network Davis Vision provider, or you'll get your $150 allowance for contact lenses in lieu of the frames and prescription glass lenses. All right, hearing aids and exams. Under this plan, you'll also just pay your $10 copay for 1 hearing exam each year. All right, it's a $699 copay for your standard digital hearing aid under this plan, and you would pay your $999 copay for your premium digital hearing aid under the plan. And all aids include a rechargeable option, and you get 1 aid per ear per year. Okay, have to utilize our vendor True Hearing, and it's a $0 copay for your 3 fittings and your evaluations per year to make sure that the hearing aid is working well for you, okay? A 1-year warranty and a 45-day trial period on your hearing aid as well, okay? As well as a starter pack of batteries that's included with all hearing aids. All right, Personal Choice Prime PPO Dental, Vision, and Hearing. Here's how the out-of-network benefits work, okay? The preventive dental, you pay an 80%. There's an 80% coinsurance for exams, cleanings, and dental x-rays. So it's an 80-20 split pretty much for comprehensive and preventive services, okay? Now, if you go out of network, these limits are combined with in and out of network. So you don't get $1,500 to go out of network and then $1,500 to go in. If you utilize half and half, those are combined together, and you will not be able to split the $1,500 up. Okay. Routine vision exam, same thing. It's 80% coinsurance. Any non-Davis vision providers, you pay an 80% coinsurance for frames, lenses, or contact lenses, and that's combined also with your $150 allowance each year as well. All right. And if you use a non-Vision Works providers are national, therefore you must use up to $200 combined. Maximum applies to in or out of the PA5 service area. So even if you're out of the area and you get it, some lenses or frames, that $200 is your $200. Once you use that up, it's pretty much it's gone. It's exhausted. All right. And you must use True Hearing providers for any in and out of network services, and you must coordinate through True Hearing. If you do not utilize the True Hearing vendor to get the hearing aid or need the hearing services, it may not be covered under your plan. All right. And our Personal Choice 65 product. Our MA product in Philly and Bucks is $184, and our MAPD option in Philly and Bucks is $290. In Chester, Delaware, and Montco, it's $161. You'll find that your PCP copay will be $5, specialist $35. Any emergency rooms would be $90. If you walked into a retail urgent care clinic, it will be $5. If you actually walked into the retail, an actual urgent care center, it will be $40, excuse me. Anything done on an outpatient basis at a hospital will be a $300 copay. Anything done on an outpatient basis at an ambulatory surgical center, it will be a $150 copay. So it's an even split down the middle, okay? Anything done on an inpatient hospital basis where you have to stay in the hospital, you will be charged a $240 copay for a maximum of 6 days, which brings your out-of-pocket to $1,440 for that stay, which goes towards your $5,000 in-network MOOP for the year. And if you utilize out-of-network providers, you would just pay a 30% coinsurance under this plan. Okay, specialist visits have gone down from $40 to $35. Again, we've added the behavioral health telemedicine benefit for $5 and taken away the $5 cost for telemedicine regular medical visits. Acupuncture, 6 visits per year. Comprehensive dental, vision, and hearing is included within this plan this year. It's embedded, and the MOOP went down from $5,500 to $5,000. All right. Inpatient hospital stay has gone down under the on the plan to $60 over the span of that 6-day period. So if you want to look at it, it's $10 per day, which would be $60 over the life of your stay. Okay. Inpatient mental health, it's the same benefit as inpatient medical, $240 per day, 6-day maximum. Skilled nursing, it's $184 per day, which increased from 2020 from $165 to $184. Okay. And the premium across the board has gone up $2. In Philly and Bucks, it was $288. It's now $290. And in Chester, Delaware, and Montgomery, it was $151. It's now $159. It is now $161. Again, on the Personal Choice plan, you get your comprehensive dental benefits. Pay a $0 copay for your exam and cleaning every 6 months. Your $0 copay for your X-ray, which is your 1 bite wing, and then your periapical and your full mouth, it's every 3, and it's a $0 copay as well. Still get your $1,500 combined allowance for in and out of network for dental services, and you would pay 20% for restorative services, endodontic extractions, and periodontic services. 40% coinsurance will be paid for any prosthodontic or oral and maxillofacial surgeries. Vision. You will pay your $10 copay for your 1 routine eye exam per year. And again, on all plans, the vision benefits do not change. You get your $200 allowance every year for your frames and lenses if purchased through VisionWorks, and $150 allowance for lenses and frames purchased through a Davis Vision provider. And if you wanted to get contact lenses, you would just go through Davis Vision as well, and you'll be able to utilize that benefit. But again, It's either or, not frames and lenses and contacts. It's either contacts or frames and lenses. Okay, hearing aids, hearing and aids and exams. You pay a $10 copay for one routine exam every year. Hearing aids, you would pay a $499 copay for a standard digital hearing aid and a $799 copay for a premium hearing aid. Okay. Again, this is zero copay for your 3 fittings and evals per year. You get your 1-year warranty and 45-day trial period, as well as starter pack of batteries. Okay. Again, out-of-network dental, any routine dental services. It's an 80-20 split, and those include exams and cleanings for preventative, any comprehensive, endodontic, periodontic, extractions, prosthodontic. It's combined. That 80% coinsurance is combined with your $1,500 comprehensive maximum in and out of network that you have each year. Okay. Routine vision, it's an 80% coinsurance. Non-Davis vision providers, just like with the dental, it's the 80% coinsurance, and it's combined with your $150 in-network and out-of-network maximum every year. Eyewear through VisionWorks, you will get your $200, but it's in and out of network. So if you obviously in another area and you utilize a VisionWorks provider, that $200 is for the maximum for the year. So it doesn't matter where in or out of network. You can't double dip, say, and utilize 200 in and 200 out. Okay. Our visitor traveler program. That's a very, very good benefit that we're able to offer to our members. Both our Personal Choice Prime and Personal Choice PPO members have access to our visitor traveler programs, which means they remain out of their planned service area for 12 months at a time. Okay. Members seeking care with participating providers in the Medicare Advantage program service area of the Blue Shield plans, which includes 37 states and 1 territory, pay the same cost sharing as they receive from in-network in our service area. So let's say, for example, you were in California, visiting and staying with a relative for 6 months. If you wanted to go utilize a California Blue provider that was in their network, you could do so because it's Blue to Blue, and you would pay the in-network cost sharing. Okay, and these are below listed the areas that have Blue to Blue, where you would be able to utilize that visitor traveler benefit. All right. Part D basics. Our 5-tier closed formulary in 2021 Independence Individual HMO and Point-of-Service and PPO plans that include RX coverage. That is all of our Medicare Advantage with prescription drug plans will offer coverage through a 5-tier closed formulary, which means the formulary does not include every possible Part D drug. However, the formulary still includes at least 2 drugs from each therapeutic class. Utilization management edits may apply. Members can still request non-formulary drugs by having their provider submit a formulary exception request for consideration. Okay. The 5-tier closed formulary includes Tier 1 preferred generics, Tier 2 generics, Tier 3 preferred brands, Tier 4 non-preferred drugs, Tier 5 specialty drugs. Okay. Formulary requirements and coverage rules. Certain drugs have restrictions or limits to coverage. When reviewing the formulary with the beneficiary, it's important to know and understand the terms below. Step therapy. The member must try 1 or more similar low-cost drugs before the plan will cover another drug used to treat the medical condition. Prior authorization requires the member or their physician to get approval in advance for certain drugs. And quantity limits. For certain drugs, the plan limits the amount of the drug that it will cover. Okay. If a member wants to utilize mail order services, here's the mail order form. Our mail order vendor is Future Scripts, and they will be able to do so. They can get up to a 90-day supply and pay only 2 copays. Orders will typically get there within 14 days. Okay. We ask when the members are doing these mail order requests that they have at least 3 weeks of their prescription left so that once we fill it, they won't be up against the wall with their medications and be worrying about running out prior to their mail order getting there. Okay? And they'll also need to submit a request to the mail order pharmacy, okay, which is this form. Okay, 90-day supply at preferred pharmacies. Members can get a 90-day retail supply of tier 1 and 2 generics at our preferred pharmacies, for 2 copays, and the member saves 1. Okay, so if they go to Walgreens, ShopRite, CVS, or Wegmans, they can go pay for their medications with a 90-day supply right at the pharmacy. Okay. Medicare Part B versus Part D. How medications are covered depends on the type of medications you receive and where you receive them. Medicare Part D drugs. Medicare Part B, excuse me. Medicare requires that certain medications like DME, durable medical equipment, test strips, lancets, and nebulizers be covered under Part B. Certain select Part B drugs and medical supplies, such as diabetic supplies, may be available at a pharmacy or from a DME supplier. The formulary will list which drugs that may be covered under Part B or Part D, depending on your medical condition. Okay, if you look at the chart, if I didn't lose you, you'll see what falls under Part B and what falls under Part D. As you can see, flu shots, pneumonia shots fall under Part B. Shingles, Tdap shots fall under Part D, okay? So, and then as you can see, tetanus and rabies, depending on the situation, would determine how it will be covered, whether it be medical or Part D, okay? And closing the Part B coverage gap. In the past several years, Medicare beneficiaries have paid less in the coverage gap until it is closed in 2020. Closing the Part D coverage gap means that in 2020 and after, Medicare beneficiaries will pay no more than 25% for covered brand name and generic drugs during the gap. Independence Part D benefit through the coverage gap mirrors the CMS standard Part D benefit of 25% for covered generic and brand drugs. Now, we have a few additional benefits and services that we're offering in the 2021 plan year, and just want to go over those really quickly. Our telemedicine benefit, obviously you pay a $0 copay for medical services and $5 copay for behavioral health services. It's offered 24 hours a day, 7 days a week, and you must utilize MD Live providers, okay? And MD Live are telemedicine doctors and state licensed physicians, okay? Telemedicine is not intended to replace a member's PCP, but only add additional access when needed. Telemedicine visits are used to treat non-emergent medical conditions, cold, flu, rash, sinus infections, and sprains. Members will access MD Live by a toll-free phone, secure video chat, or through their website home app. And remember, they will have to pay that $5 copay prior to the visit starting, okay? Another one thing that we're offering for 2021, our over-the-counter benefit. Our new over-the-counter vendor is Income in 2021. It's available on all Medicare Advantage plans. A $30 or $60 allowance is available to you for use depending on which plan you enroll in. The over-the-counter allowance is provided quarterly, so it does not roll over, use it or lose it. OTC allowance does not carry forward to the next quarter if it is not used. OTC purchases cannot exceed the $30 or $60 quarterly allowance. Members will be issued an OTC card that can be used to purchase over-the-counter products and health-related items. They can visit nationsotc.com for home delivery once purchasing, or they can call the 800 number, or they can also use their card at Walmart, CVS, Walgreens, Rite Aid, General Dollar, Family Dollar, and many more. They can use the over-the-counter card on dental floss, pain relief medication, allergy and sinus relief medication, cold and flu tablets, vitamins and minerals, and thousands more. They'll just need to call, activate their card, just as they would if they lost their bank card and you received a new debit card in the mail. You'll just call the number on the call on the little sticker, activate it. Once you activate it, you'll be able to make purchases. Okay. You do not feel comfortable going out still utilizing the card and going shopping, they can still go right online, order their stuff for home delivery, or they can utilize the catalog that they've had in the past. All members are entitled to their annual physical exam at zero cost sharing per year. And the exam will include a detailed medical family history, head-to-toe assessment, and hands-on examination of all body systems, an EKG screening, general appearance of how you look, heart, lung, head, neck, and extremity examinations as well. We also have a 24-hour nurse line for our members to use. Members must access the toll-free nurse hotline 24 hours a day, 7 days a week. The nurse will assist members with all health conditions, questions, or concerns about management of chronic conditions. If you do not feel comfortable with if you utilize the nurse line often and you feel as though you may need more specific needs, we also have a health coach, which can be assigned to that beneficiary who may have more, may call more often than some others do, and would like to have someone that knows their specific health conditions and their needs. We can assign them a health coach who will then be able to go over all of that with the member, and these health coaches are licensed registered nurses. Okay. We also have our silver sneakers gym membership, which is important to our members at no cost sharing. They have access to all the equipment, amenities offered in the basic fitness membership, and access to program advisors for guidance, social activities and educational seminars. And with this uncertain time, gyms that are open, that are practicing social distancing and doing those things, this would be really good for seniors that want to get out and socialize with their friends that they're used to seeing at the fitness center and at the gyms and at the different YMCAs and places around the city. So silver sneakers is probably going to be really good this year because everyone is itching to get out. Okay. And silver sneakers, we have over 13,000 participating locations available nationwide and in Puerto Rico. And if they want, they can access more information at silversneakers.com. Okay. We also have a Silver Sneakers Steps program. It's another opportunity for members to stay fit. Silver Sneakers Step program can be ordered for members who like to exercise at home, may not live close to a facility, or for use when traveling. Okay. And they can order one kit per year, and includes general fitness, strength, walking, and yoga. It'll help you do all of those things if you like, if you're interested in, if those seniors are interested in working out. And we do have a lot of seniors that are interested in physical fitness and getting out and being active with their fitness and their health. All right, and just some key takeaways to remember. We have our Vital Care program is something else that's new. Our Vital Care program is going to be only available on our individual HMO and point-of-service plans. The purpose of our Vital Care program is to help our members who often need to see several specialists more than once a year improve their overall health and well-being. In addition, the Vital Care program helps our members by making these visits more affordable and encourages them to see their physicians regularly. The Vital Care program will vary by members' plan enrollment. Vital Care members are identified through claims data and then enrolled into the program the following month. Members cannot be provider referred or self-referred to the program. Vital Care members can choose to opt out of the program. Now, what the Vital Care program is this, and it's offered to those members with diabetes, congestive heart failure, any of those chronic needs. So I know a lot of us, we market to those in the Philadelphia market who have a lot of chronic needs. This Vital Care program is now going to help us penetrate that with those members that are maybe on a C-SNP or a D-SNP plan, because now they have the access to doctors if they have congestive heart failure or diabetes. That's the cause for the Vital Care program. We wanted to make sure that we're touching all members, and we think with this plan, we'll be able to do so. Okay, they cannot enroll in the program. The only way we will know that they're enrolled, that they have congestive heart failure, diabetes, or one of these chronic needs is based on claims data. Once we receive data from a claim, medication, doctor visit, something like that, that they are going to that provider for one of these chronic needs, they will automatically be enrolled in the plan. If they're enrolled in the plan, podiatry visits are $5, cardiology visits are $10, endocrinology visits are $10, and pulmonology visits are $10 as well as the extra allowance that they get on their over-the-counter allowances. Now, again, members may state that they have diabetes or congestive heart failure or have these things, but if we do not have medical diagnosis on a claim, it will not enroll the member into that. So I just wanted to stress that, let you know it's processed based on claims data from the member, okay? And this is what the Vital Care card will look like. You'll see at the bottom, it says Vital Care Program on it, and specialists will vary, obviously, because they won't pay the same specialist copay as everyone else because they're enrolled in that Vital Care program for whatever chronic need that they have. All right, preferred and standard pharmacy network, members will pay a reduced copay for certain prescriptions filled at one of the plan's preferred pharmacies. Our standard pharmacy network, members can use their prescription drug benefits at any standard pharmacy network. However, they will pay a little bit higher cost sharing out of pocket, okay? Mail order prescriptions will also be at the preferred cost sharing, and out of network pharmacies, standard cost sharing will apply. Our preferred pharmacies are Walgreens, CVS, ShopRite, Wegmans, and our standard pharmacies are Walmart, Sam's, Rite Aid, and Costco. And this is just a partial list. If you need a complete list, you can always go to ibxmedicare.com and search under pharmacies. Okay, and finally, diabetic supplies. Accucheck and One Touch are our preferred brands that we covered under the plan. Under each plan, you'll see you're eligible for one either or at a zero copay under each plan. Okay. Blood glucose meters, other brands, depending on the plan that you have, will determine what the out-of-pocket cost would be. Okay. But Accucheck and One Touch, you are eligible for one at a zero cost sharing. Okay, and here's what they look like. The diabetic shoes, inserts, and insulin pumps are also covered at a zero copay. Okay, new plan members will be allowed a one-time diabetic transition fill during their first 90 days of being new to Blue. They must switch to a preferred manufacturer brand once the transition supply is over. If they continue to use non-preferred brands, the claims will deny. And they will need to get a new prescription from their provider for their diabetic supplies. Okay, chiropractic and podiatry visits. They get 6 routine chiropractic and 6 routine podiatry visits included as part of their plan. Routine chiropractic services will cover spinal manipulations for preventative conditions, and podiatry will cover services such as trimming toenails, removing corns, or for all diagnosis, just not just Medicare covered. All right, one copay for multiple services. Diagnostic radiology. This was a big one. You go in for an X-ray, they send you down the hall, and you get a CAT scan, and now you're charged 2 different copays. That's gone. This year, you'll pay the higher of the copay of the 2, but if you get 2 radiological services rendered on the same date of service, you will only pay the higher copay of the two. Same date, same location though. Same date, same location, you'll pay the higher of the two. Now, if you go for two different radiological services, two different facilities on the same day, you'll still pay those two copays. But just make sure you stress to the member, same day, same location, one copay, higher of the two. Same thing with physical, occupational, and speech therapy. Only one copay will apply when a member obtains PT, OT, or speech therapy on the same day at the same location. Our plans cover preventative services at zero copay. Members should be encouraged to take advantage of these benefits, which promote staying healthy and identifying potential health issues early. These services include, but are not limited to, your Welcome to Medicare exam, your annual wellness visit, your annual physical, flu, pneumonia, and hepatitis B, immunizations, bone density, pap smear and pelvic exams, your mammogram, and your colorectal screening, preventive screening, okay? And for a complete list of what's covered, they can always go to ibxmedicare.com, and the evidence of coverage will outline that for them. Outpatient observation stays. This is observation services are at an outpatient hospital stay where an individual's medical condition is closely monitored for a prolonged period of time. A member can be admitted to observation from an emergency room visit, or a member can be admitted directly to observation from a provider's office visit or an urgent care visit. An individual admitted for an outpatient observation stay is not considered to be an inpatient, okay? One outpatient hospital copay will apply per observation stay. Members admitted into observation from the ER for a period of 8 hours or greater will pay the outpatient hospital copay, one copay per stay. Members who are in the ER and or observation period for under 8 hours will be charged the ER copay. Members admitted directly to the observation will pay the outpatient hospital copay, all right? And just touching on quickly our Medigap Freedom Plan for anyone marketing Medigap products. Our plan focuses on lower premiums and competitive pricing. We're offering plans ABF, high deductible F, G, high deductible G, and Plan N. Outside of Medigap open enrollment and guaranteed issue periods, individuals must respond to health status questions on the application, okay? So if it's not open enrollment or a guaranteed issue period, they will have to go through medical underwriting, is what that means, okay? Attained age goes by plan rating. Age 65 to 67 through 67, the member will have the same premium. Male and female, tobacco, non-tobacco. While in Medigap open enrollment or guaranteed issue rights, preferred rates will apply, non-tobacco rates, okay? Also included is the Healthy Lifestyles, True Hearing, and Davis Vision discount programs, okay? So they still get the access of the True Hearing and Davis, even on the supplement. And as you can see, this is what each of the supplements covers. For anyone familiar with selling Medicare supplements. All right, and while Independence continues to work hard to keep costs down, the cost of healthcare continues to rise as our members are using more healthcare services. The members' premiums will not change due to the members' health. Rates are subject to change only with approval from the Pennsylvania Insurance Department. Attained age rating, the premium is based on the age when the beneficiary buys the Medigap policy. In this rating structure, in addition to a possible annual rate increase due to inflation, members will see a rate increase with the exception of ages 65 through 67 when they move to the next age band based on their birthday. Okay, and this is our attained age chart. And anyone marketing in Medigap Freedom products will see this this chart. And if you have any questions on it, I'll feel free to reach out to me, and I'll be able to help you guys, anybody directly, with answering any questions about the Medigap Freedom. All right, and we have the Healthy Lifestyles. fitness reimbursement, tobacco cessation, and our weight management programs. Okay. With the fitness reimbursement, you get $150 back after you go to 120 workouts within a 365-day period at an approved gym. Okay. They would just have to join an approved fitness center, exercise regularly, record the workouts, and submit the documentation to us via the portal. They can just get a printout right from their local gym that they go to, and it'll tell them all of the days that they went to the gym within that 365-day period. It's a really simple printout to get from the gym. Okay. And members also get $150 back when participating in an approved weight management program. If they wanted to utilize Weight Watchers, they could do so. They just complete the program and then submit documentation for reimbursement as well. Same thing for smoking cessation. Sign up for an approved smoking cessation program, submit the completed documentation to your portal, and get your $150 credit back. All right. They get discounts for vision benefits through Davis. As well as True Hearing discounts on hearing benefits as well. And these are all benefits when selling a Medigap Freedom that you'll have access to. Any questions?
Hey, Chris, I did not see any questions come in during the chat, but thanks so much.
Okay. All right. And if you get any questions, just feel free to send them over to me in an email, and I'll be glad to answer them and get them responses as quick as possible.
Awesome. Hey, thank you so much. I really appreciate it. There was a ton of great information. Like Chris said, if anyone has any questions, please feel free to email over to us, give us a call, talk to your local marketer or sales manager or agency team. We're all here to better support you guys all throughout AEP. If there's anything else that you need, please let us know. All right.
Have a great day, guys. I really appreciate all of your time. Thanks for taking it out to let me present. I know it's a long presentation and it can be hard sitting virtually in these types of things. I'm much more interactive and stuff like that in person. So hopefully down the line, I'll be working with you and seeing all of you soon and making the relationship more fruitful and not just virtual.
Well, thanks again, Chris. It was really insightful, and we appreciate your time and information today.
Thank you. Have a great rest of your day, and have a great AEP, and I'll be talking to you guys a lot.
Perfect. Talk to you soon.
Thanks.
Have a good one.
Talk to you soon. Bye-bye.